Okay, good evening all. Without wasting time, you are welcome to this evening's lecture once again. Today we are going to continue from where we stopped doing the offline lectures. Today in the morning we discussed the nomogram and how to make use of the nomogram. From there we went to drip set. So we stopped at drip rate specifically, not drip set, sorry, drip rates. We stopped at the things to consider while calculating the rates at which intravenous infusions are administered. We made mention of knowing the right amount of drug that is to be given over time. We also made mention of the amount of drug needed to last a certain time and the amount of time left until an IV is empty. So we are going to kick off from that point. Now, there's a very important factor I need to mention. We call it the drip. We call it the okay. There's an important thing I want to mention here during the calculation of during the calculation of drip rates. You know, I've already mentioned different 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 things to consider, and I made mention of determining the infusion rate in terms of drops per minute, milliliter per minute, and even the amount of drug per hour. Now, there's an important thing that is we need to take note of. It is called drop factor. Drop factor. Unlike mil per minute, amount per hour, this one has to do with, it's not rate per se, as in time rate anyway. This one is called drop factor. Drop factor is actually drops per mil. Is actually drop per mil. Is actually drop per mil. Come and give me checkbook. Give me my school. Is actually drop per mil. Onyo Okeke, mute your microphone if you are discussing in the background. Mute your mic. Everybody mute your mic. Unless you want to speak, please, so that noise will not interfere with what you are doing here. Thank you. Now, it's called drop factor. It's actually drops per mil. Now, what do we use this drop factor to do? Now, you know drip set, or you call it drip giving set. Apart from the intravenous bag, there are these tubing through which the drip flows. We call it the drip giving set. Now, the size of this tube used to deliver this medication, the sizing of the tube is also a factor to consider. So this factor to consider has something to do with the drops that tube can deliver per mil. Now, this drop factor is given on each set of tubing. That means each tubing has its own drop factor. Each tubing has its own drop factor. That means if you have a tubing set that states that states 10 drop per mil, if you have a tubing set that states drop per mil, that is written 10 drop per mil, the symbol for drop per mil is GTT. So GTT slash ml, that is the symbol for drop per mil. Now, this drop factor will be used to determine the rate at which the medication flows in that tube. So there are various drop factors available. We have 10 drop per mil, we have 20 drop per mil, we also have 25, we have 50, we have 60, we also have 100 drop per mil. So a drop factor is actually designated with the symbol DF. So a DF of 50 drop per mil is often referred to as a micro drip or micro drop administration kit. A micro drip has drop factor of 50. Please mute your mic. What is all this? Mute your mic. If you don't mute your mic, I will remove you from this class. Everybody mute your mic. Any noise again on the background, I'll remove the person straight. Now, if you have any question as I teach, please call my attention. Don't keep quiet. So I said that the DF of 50 drop per mil is often referred to as a micro drip. A micro drip or a micro drip administration kit. Now, most of the calculation we'll be doing on this drip rate will have a lot to do with the drop factor. Remember I said that drop factor is a feature of each tubing, that is each drip set used to deliver the medication from the IV bag. So each tubing has its own drop factor. And remember I said that drop factor is drop per mil. By the time we start calculation, we'll have a better understanding of what this drop factor is all about. Okay, now at this point now, I want to do one or two, look at a question, do one or two calculation, so that we'll have a better understanding of what we are talking about. Now, in the material for this pediatric dosing, if you take a good look at exercise 4.15, if you have the material, open it. If you have the material, please raise your hands. I need someone to read this question for us. Who has the material? Raise your hand. Let me see. I think all of us have the material. I'll call names. Okay, Echekubelo Christopher, read the exercise for 4.15, question 1 there. Fast.
Order.
Oh, good.
2 liter to run at 150 milliliter per hour.
Okay.
Question A. How many hours will this solution last?
Good. It says order. What it means that it can be medication order or prescription as case may be. This is what was written. What was written by the doctor to give to a patient. Am I communicating? Now, it says 2 liter. This TPN means total parenteral nutrition. It means total parenteral nutrition. Is another way of feeding. Giving, today you go and eat apple, eat rice, take fruit like oranges. Now, what your body takes in is the nutrient contained in this food. There are some patients that cannot, I'm trying to explain TPN. There are some patients that cannot, maybe because of type of ailments they have, type of, because of what they are suffering, they cannot eat. So they have a way of delivering these nutrients in the form of fluid into the blood, into the person's system, so that the person will get the so that the person will get the nutrient the person needs. Now that is what total parenteral nutrition is all about. Now, the question says 2 liters of TPN to run at 150 ml per hour. How many hours will this solution last? Now, if you look at the question, the order says 2 liters of TPN to run at 150 ml per hour. Now, can someone tell me which of these is the drip rate? Which of these parameters given is the drip rate from what we explained? Huh?
150 milliliter per hour.
Good, yes, because it talks about the volume delivered per hour. So the drip runs at the rate of 150 ml per hour. So in each 1 hour, 150 ml of the TPN will be delivered. But you are giving total a volume of 2 liter of the TPN to be delivered. They're asking how many hours will it take to deliver the complete 2 liter. If it takes 1 hour to deliver 150 ml, how many hours will it take to deliver 2 liters? It's a simple calculation. It's not. It's simple. All you need to do is to convert that 2 liter to what? Meals. How many liters makes how many meals make 1 liter? Hmm? How many?
1,000 meals.
Good. 1,000 meals make 1 liter. So if you have 2 liters, that means you have 2,000 what? Meals. So if 1 hour, if 150 meal were delivered in 1 hour, then 2,000 meals will be delivered in how many hours? You cross multiply and get the answer. Do it fast. What's the answer? Please, this class is not for only one person. No. That you mute your mic doesn't mean if you have something to say, put it on. Or if I ask a question, put it on and answer my question. Benita Oya, what is the answer? Cross multiply. If 1 hour, if 150 mil is for 1 hour, 2,000 liters is how many hours? Fast. What's the answer? Benita, what's the answer? She's wasting time. Oh yeah. Okay. What's the answer? Benita, don't waste our time.
I don't know if the answer is correct though, sir.
Just tell us how you got it. Then let's look at it from how did you get the answer first? What did you do?
Sir, I cross multiplied.
So just state what you did. What did you what?
I did 150 times.
Please don't ignore don't ignore your unit. Continue. 150 times what?
150 times 150, sir. That's what I did.
All right. So who can help her, please? Who? Iwanugoya. Iwanugochi Nazoya. What is the answer? Fast. If 150 mail was delivered in 1 hour, 2,000 mails will be delivered in how many hours? Igbonugo is sleeping. Onyoke Koya.
Sir,
Yes.
I did. If 150 mil is delivered in one, then 200 mil I cross multiply.
2,000, not 200. 2,000.
2,000 mil. I cross multiply.
And got what?
150.
Okay, sorry, continue.
By 1 hour over 150 mil.
What's the answer?
That's what I'm doing.
Okay. You did 2,000 mil times 1 hour over 150 mil.
Yes.
Correct. Just punch the calculator and get the answer straight. Correct. That's the step. So what is the answer?
200. Now the answer is 200. No. Divided by 150. By 15. I think it's 1 hour.
No. You should be getting 13 hours, 13 it should be 13 point. Good.
3, I have 1.33.
No, it's not. It's 13.33 some 13.33 hours. But
okay, I should move that point.
It's 13.33 hours. That's what it should be.
Yes.
13 point.
It's calculator. I did 200 divided by 150.
It's not 200. It's 2,000. It's 2,000.
Okay, 2,000
divided by 150.
Divided 333 hours.
13.33 hours.
13 hours, 333.
Good,
13.333,
sir. But I want to teach you something. Yes, but I want to teach you something. You remember what I told you people about having numbers that are somehow not complex? Am I communicating? You don't say 13.33 hours because actually they're not like 13 point. They're not like 0.33 hours. You try to convert that point on top of it to convert it to minutes. Am I communicating? So convert that 13 hours is a whole number. Is there already that 0.33? Convert it to minutes. So convert 0.3333 to minutes, and tell me how many minutes it will give you. That 0.33 on top of it, convert it to minutes, because we know that we know that 1 hour is 60 minutes, right? Yes. So convert that 0.3333 hours to minutes. Tell me, it should give you around 20 minutes or so. Just do the punch calculator and do it. Just do if 1 hour is 60 minutes. 0.3333 hours is how many minutes? Then whatever you get, you now put join it to that 13 hours. About that 13 hours, 20 minutes or something. Do it and confirm. Fast.
13 hours, 20 minutes.
Perfect. So this is the best way to put it. Am I communicating? This is the best. This is the best way to put the answer, not 13.33 hours. Just take the whole number 13 hours. That fraction 0.333 hours. Convert it to the nearest to the lower time. This here. So which you know that after hour you have what minutes. So convert it to minutes. You get 20 minutes. Is it clear?
Yes, sir.
Good. Now that is how that is for that question. Now I want you guys at your convenient time solve the remaining from number 2 to number 5. Am I communicating? I will
Okay.
I will see what people did tomorrow. Tomorrow morning I'll see what you did. Solve it. But if you can solve it and send it to me, snap it and send me on WhatsApp. Wonderful. I want to see what you number 2 to 5. I want
Is
to.
it this night?
Yes. Solve
Okay.
for number 2 to 5. Then if you finish this now, you can send it to me on WhatsApp. If not, tomorrow morning I'll see it when I come to class.
Okay, sir.
Is it clear? Now, um,
Yeah.
this is the last thing where we draw cutting with respect to where we draw the cutting with respect to what is it called again? With respect to posology. With respect to posology. Remember in those that were in the class, I came to the class I made mention of drip set, piggyback, and what have you. If you look at the last page of this document, you see where they have a sketch of what a drip line is all about, what it looks like. If you check it, you see everything we talked about in class. So the diagram is clear. So you just go to the diagram. It explains everything we discussed on setting of line, on how the line should look like. You see everything, both the piggyback we talk about, even the small. If you see, I told you that the piggyback is actually in the piggyback is presented as small volume parentela. If you see 100 mil piggyback attached to the main IV set that has the large volume parentela, which could be normal saline or dextrose water, but it's up is 500 mil or 1000 mil. You see the 100 mil, that 100 mil you are looking at on the diagram is the piggyback attached to it, because that piggyback has its own drug that they want to deliver. So that's why they attach, so that everything will not flow from in the same tubing and enter the patient's system. Is it clear? So just go through it and
Yeah.
just go through it. So this is where we draw the curtain for what is it called again? Posology. In our next class, we start from we enter reduction and enlargement of formulas. Reduction and enlargement of formulas. When I say formula, I'm not talking about almighty formula in mathematics. I'm talking about you did your official books, official books, official reference books. There, you see some formulas of maybe preparation of different dosage forms. Maybe you see something, something like you are doing dispensing frasca right now, right? You people are doing dispensing frasca, right?
Yes.
Good. At least by now you should know what a formula is. A formula is composed of the name of of what you are compounding, and list of the ingredients and the amount of the ingredients you are going to use to prepare a particular do- dosage form. Am I communicating? So that is what the formula is all about. So now I just want to have an overview of why we reduce formula and why we enlarge formula. Sometimes the formula you have in the official book, maybe they may have formula that will produce only one bottle of a particular of a particular medicine. But maybe where you are working, maybe in pharmacy you need to produce compound for our 5 people. You see that you need to enlarge that formula by making it to be able to produce the quantity that up to 5 people can use. Am I communicating? Now, the same way, those that are working in a large-scale production, maybe in pharmaceutical industries where they do large-scale production, that formula you see in official book that may just produce maybe only 2 or 3 bottles, or maybe small amount of bottles or tablet of that particular, or sorry, maybe ointment, 1 tube or 2 tubes, as the case may be, maybe calamine lotion, 1 bottle or 2 bottles. When you before you can now use that same formula to produce thousands of bottles of calamine lotion, you have to enlarge that formula so that it can use it to get the appropriate ingredient, the quantity of ingredient that can help you to manufacture, formulate up to 1,000 bottles of calamine lotion. So by the time we meet tomorrow, I will now go deep to tell you how to do this enlargement of formula. And sometimes the formula you have in the official book maybe the formula that can produce like 10 bottles of maybe calamine lotion. For example, I'm just giving you most of the things I'm saying are just what I just fixed the amount. I just fixed arbitrarily to explain something. Maybe the one you have in official book can produce like 10 bottles of calamine lotion. But if you have a patient that you are compounding for, maybe a patient that needs calamine lotion, are you going to use the formula that would, and quantity of ingredient that would, to produce 10 bottles? Who will you sell? Who will you give that 10 bottles to? Where you only need 1 bottle to give to a patient, maybe in compounding room in the pharmacy where you're working, or hospital. You see that in this case now you need to reduce that formula. So that from the formula you can reduce the ingredient to be able to compound only 1 bottle that can be given to the patient. I don't know if I'm making sense. So this is what enlargement of formula and reduction of formula is all about. By tomorrow, we'll cool down and look into it and solve 1 or 2 examples on what reduction and enlargement of formula is all about. Any question? If you have any question, ask. If you have any question, ask. Any question? Any question?
Hello, sir.
All right, I'm with you.
Now, sir, please don't be angry. I don't know how they converted that to 20 minutes.
20 what?
That 13.20 minutes.
Okay, you don't know how they converted it. Good. Why will I be angry? You're asking question now. I will explain to you. I get angry if you are making noise in the background. That's when I get angry.
Okay,
But if you have question, I'll answer you. Now, what happens is this. In measurement of time, you have units, the different units, right? Just as you have in naira, we have